She walked into my office with a pill box that had 28 compartments, 7 pills, 4 times a day. Margaret was 72, sharp as a tack, and she told me her medications were keeping her alive. I looked at her list. 3 of those medications were actually increasing her risk of sudden cardiac arrest. Her primary care doctor had never told her that the rules change after 60. Your liver slows down. Your kidneys filter differently. The blood-brain barrier becomes more porous. What worked at 55 can kill you at 70. And here's what nobody tells you. 5 of the most commonly prescribed medications in America become dangerous after 60, but doctors keep prescribing them because the guidelines were written for younger bodies. Margaret is not alone. I see this every single week. Patients who trusted their doctors, took their pills exactly as prescribed, and ended up on my operating table because nobody explained that aging changes everything. By the end of this video, you will know which 5 medications to question, why they become risky after 60, and what to ask your doctor starting tonight. I am a cardiothoracic surgeon. I have held beating hearts in my hands for over 3 decades. I have performed more than 2,000 open heart surgeries, and I can tell you this with certainty. At least 30% of my patients over 60 were taking medications that contributed to the very condition I was operating on. Not because the medications were wrong when they were prescribed, but because nobody recalibrated them as the body aged. The pharmaceutical industry does not make money from telling you to stop taking pills. Your insurance company does not get reimbursed for deprescribing. And most primary care doctors have 12 minutes per appointment, which is not enough time to review a medication list that has grown over 20 years. So you keep taking what you were told to take. And your heart, your brain, your kidneys pay the price. I have watched families in waiting rooms hold each other while I explained that the arrhythmia or the stroke or the bleeding could have been prevented. This is not about blaming your doctor. This is about you understanding that your body at 65 is not the same machine it was at 45. Your heart has been working for you every single minute of every single day since before you were born. After 60 years, the muscle is still strong, but the electrical system gets temperamental. The valves stiffen. The coronary arteries narrow. Think of it like this. Your heart is a house that has been standing for 6 decades. The foundation is solid, but the wiring is old. The plumbing has calcium buildup, and the walls are not as flexible as they used to be. You would not choose the same voltage in that house that you used when it was new. But that is exactly what happens when medications designed for younger bodies keep running through older systems at the same dose. One study from the Journal of the American Geriatric Society found that 42% of adults over 65 are taking at least one medication that is inappropriate for their age. 42%. And the risk compounds. Each inappropriate medication increases your chance of hospitalization by 12%. Now imagine you are on 3 of them. The first medication you need to question after 60 is non-steroidal anti-inflammatory drugs. NSAIDs, ibuprofen, naproxen, Advil, Aleve, Motrin. You have been taking them for years for your knee pain, your back pain, your headaches. They are over the counter, so they must be safe, right? Wrong. After 60, NSAIDs become one of the most dangerous classes of drugs you can put in your body. Here is the mechanism. NSAIDs block an enzyme called cyclooxygenase, or COX, which reduces inflammation, but also reduces the protective lining of your stomach and interferes with platelet function. Platelets are the cells that make your blood clot. When you are younger, your body compensates. Your stomach produces extra mucus. Your kidneys filter efficiently. Your blood vessels remain flexible. After 60, none of that happens the same way. Your stomach lining is thinner. You produce less protective mucus. Your kidneys are slower to clear the drug, so it accumulates in your system. And your blood vessels are already stiffer from decades of wear. The result? Gastric bleeding that can land you in the emergency room. Kidney failure that puts you on dialysis. Heart attack. Stroke. I am not exaggerating. A meta-analysis published in The Lancet reviewed data from over 350,000 patients and showed that regular NSAID use after 60 increases your risk of heart attack by 30% and stroke by 40%. Write that down. The mechanism is straightforward. NSAIDs cause sodium and water retention, which raises blood pressure. They constrict blood vessels. They promote clot formation in arteries that are already narrowed by plaque. Your 65-year-old heart cannot handle that extra stress the way your 40-year-old heart could. I had a patient named Robert, 78, retired mechanic, who took 2 Aleve every morning for his arthritis. He had been doing it for 12 years. His knees hurt. The Aleve helped. Nobody told him to stop. He came to me with unstable angina, chest pain that was getting worse, and kidney function at 40% of normal. When we stopped the Aleve and switched him to targeted physical therapy, daily stretching, and low-dose acetaminophen on bad days, his kidney function improved to 60% within 8 weeks. His chest pain reduced. He avoided bypass surgery. He is still here, working in his garage, moving better than he has in years. What is your alternative? Acetaminophen is safer for your heart and kidneys if used at the right dose, no more than 3,000 milligrams per day. Physical therapy actually works if you commit to it. Topical creams with capsaicin or diclofenac go directly to the joint without systemic effects. Ice and heat. Weight loss if needed. Strengthening exercises. If you absolutely need an NSAID for acute pain, use the lowest dose for the shortest time possible. 3 days maximum. And never, ever take it daily without your doctor knowing your kidney function and cardiovascular risk. Have you been taking ibuprofen or naproxen every day for months or years? Drop a comment and tell me how long. I want to know how many of you are doing this right now. The second medication is first-generation antihistamines, diphenhydramine, Benadryl, doxylamine, which is in most over-the-counter sleep aids like Unisom, Zizquil, and anything with PM in the name. Tylenol PM, Advil PM. You take it for allergies. You take it to fall asleep. It has been in your medicine cabinet for decades. Your mother probably gave it to you as a child. After 60, it becomes a cognitive poison. Here is why. Diphenhydramine is what we call an anticholinergic drug. It blocks acetylcholine, a neurotransmitter that your brain uses for memory, attention, learning, and muscle control. Acetylcholine is essential for forming new memories and retrieving old ones. When you are young, your brain produces acetylcholine in abundance. You can block some of it without noticing. After 60, you do not have that buffer. Your baseline acetylcholine levels drop naturally with age. Your brain is already working harder to maintain cognitive function. Blocking acetylcholine further increases your risk of dementia, delirium, falls, constipation, dry mouth, blurred vision, and urinary retention. But dementia is the one that should terrify you. A study from JAMA Internal Medicine followed over 3,000 adults over 65 for more than 7 years. Those who used anticholinergic drugs like Benadryl regularly had a 54% higher risk of developing dementia, 54%. And the effect is dose-dependent and cumulative. The more you take, the longer you take it, the higher the risk. Even worse, the damage may be irreversible. Once those brain cells are gone, they do not come back. I had a patient named Linda, 69, a retired teacher, who had been taking Benadryl every night to sleep for 15 years, 25 milligrams. One little pink pill. She started forgetting names of her grandchildren. Then she missed appointments. Then she got lost driving home from the grocery store, a route she had driven 1,000 times. Her family thought it was early Alzheimer's. Her daughter was researching memory care facilities. We stopped the Benadryl. I put her on a proper sleep evaluation. We found mild sleep apnea. We treated that. Within 6 weeks, her memory improved. Not completely. Some damage was permanent. But significantly, she could remember her grandkids' names again. She stopped getting lost. She cried in my office. She said nobody had ever told her that her sleep aid was affecting her brain. Nobody connected the dots. What should you use instead? For allergies, second-generation antihistamines like cetirizine, which is Zyrtec, or loratadine, which is Claritin, are much safer. They do not cross the blood-brain barrier the way Benadryl does. For sleep, melatonin is safer, though not perfect. Cognitive behavioral therapy for insomnia actually works better than any pill. Or address the root cause. Is it sleep apnea? Anxiety? Restless legs? Pain? Treat that instead of masking it. If you have been taking Benadryl or any PM medication nightly for months or years, it is time to stop. Starting tonight. Stay with me, because what I am about to tell you next might be the most important part of this entire video. The third medication is proton pump inhibitors, PPIs. Omeprazole, lansoprazole, esomeprazole, Prilosec, Prevacid, Nexium. You started taking them for acid reflux or heartburn, maybe after a bad bout of stomach pain. Your doctor said, take one a day. That was 10 years ago. You are still taking it. After 60, long-term PPI use is linked to fractures, infections, kidney disease, and dementia. Here is the mechanism. PPIs reduce stomach acid. Stomach acid is not just for digestion. It is your first line of defense against bacteria. It helps you absorb calcium, magnesium, and vitamin B12. When you suppress acid for years, several things happen. Your bones weaken because you cannot absorb calcium properly. Your risk of bone fractures doubles. Your gut becomes vulnerable to infections like C. diff, a potentially fatal diarrhea. Your magnesium drops, which affects your heart rhythm. And emerging research shows a link between long-term PPI use and increased dementia risk, possibly due to vitamin B12 deficiency or direct effects on brain amyloid clearance. A study in JAMA Neurology found that people who used PPIs regularly had a 44% increased risk of dementia compared to those who did not. I had a patient named Thomas, 74, who fractured his hip after a minor fall. He had been on omeprazole for 16 years. His bone density scan showed severe osteoporosis. We weaned him off the PPI over 8 weeks, added calcium and vitamin D, and switched him to dietary changes and occasional antacids. His next bone scan showed improvement. He has not had another fracture. If you have been on a PPI for more than 8 weeks, you need to talk to your doctor about tapering off. Most people do not need them long-term. Lifestyle changes work. Smaller meals, avoiding trigger foods, elevating the head of your bed. H2 blockers like famotidine are safer for occasional use. It is never too late to stop. The fourth medication is benzodiazepines. Diazepam, lorazepam, alprazolam, temazepam, Valium, Ativan, Xanax, Restoril. You take them for anxiety or sleep. They work immediately. They feel like relief. After 60, they become a trap. Benzodiazepines enhance a neurotransmitter called GABA, which slows down your brain. That is why they calm you. But after 60, they slow you down too much. Your balance worsens. Your reaction time slows. Your risk of falling skyrockets. And falls after 60 often mean fractures, surgery, loss of independence, or death. A meta-analysis in the British Medical Journal found that benzodiazepine use in older adults increases fall risk by 48%. It also showed a 50% increased risk of hip fracture. But here is the worst part. Long-term benzodiazepine use is associated with cognitive decline and dementia. Just like anticholinergics, these drugs mess with your brain in ways that accumulate over time. And they are addictive. Your body builds tolerance. You need more to get the same effect. Stopping becomes harder. Withdrawal can be dangerous. I had a patient named Carol, 67, who had been on Ativan for 12 years for anxiety. She fell twice in 6 months. The second fall broke her wrist. When we tapered her off the Ativan slowly over 3 months and started her on cognitive behavioral therapy and an SSRI, her fall risk dropped. Her anxiety improved. She told me she felt sharper than she had in years. If you are on a benzodiazepine, do not stop suddenly. Taper slowly under medical supervision. There are safer alternatives for anxiety and sleep. SSRIs, buspirone, therapy, mindfulness, for sleep, melatonin, trazodone, or addressing the underlying issue. Your brain deserves better. How many of you are on a benzodiazepine right now? Comment below. Let me know how long you have been on it. The fifth medication is glyburide. It is an older diabetes medication, a sulfonylurea. If you have type 2 diabetes and you are over 60 and your doctor has you on glyburide, you need to have a conversation immediately. Here is why. Glyburide forces your pancreas to release insulin regardless of your blood sugar level. That sounds good until you realize it can drive your blood sugar dangerously low, especially in older adults who might skip a meal or have unpredictable eating patterns. Hypoglycemia, low blood sugar, causes confusion, dizziness, falls, heart attack, and stroke. After 60, your body does not sense low blood sugar as well. You do not get the warning signs. You just pass out. A study in diabetes care found that glyburide caused 3 times more severe hypoglycemic events in adults over 65 compared to other diabetes medications. And it does not even work better. Newer medications like metformin, SGLT2 inhibitors, and GLP-1 agonists control blood sugar more safely and have additional benefits for your heart and kidneys. I had a patient named James, 71, who passed out while driving. He crashed into a tree. His blood sugar was 34. He had been on glyburide for 9 years. We switched him to a safer regimen. He has not had another hypoglycemic episode. His A1C is better controlled. He is alive. If you are taking glyburide, ask your doctor about switching. There are better options, safer options. It is never too late. I need to tell you something I do not say often. There are moments in the operating room when I am working on a patient's heart and I think about the years that led them to my table. The decades of small decisions, the pills taken without question, the symptoms ignored, the trust placed in a system that did not have time to sit down and explain what was happening inside their body. I think about the families in the waiting room, the wife who has been married for 50 years, the son who flew in from across the country, the daughter who is terrified of losing her father. And I think about how many of these surgeries could have been prevented, not by some miracle drug or expensive procedure, but by someone taking 15 minutes to review a medication list and ask, does this still make sense for a 73-year-old body? I am not angry at your doctors. I know they are drowning in patients and paperwork, but I am angry at a system that prioritizes prescribing over deprescribing. That makes it easier to add a pill than to question whether it is still needed. Your heart has been beating for you for 60, 70, 80 years without you ever thinking about it. It deserves more than blind trust in a medication list that nobody has updated in a decade. Margaret, the woman I told you about at the beginning, came back to see me 6 months after we reviewed her medications. We had reduced her daily pills from 28 to 11. We stopped 3 dangerous ones entirely. We adjusted doses on 4 others. She brought me a handwritten note. It said, "Nobody ever told me I could feel this good again. Nobody ever told me I had options. Thank you for giving me my life back." That question has stayed with me. Why did nobody tell her? Why do so many of you not know that the rules change after 60? Let me summarize the 5 medications to question after 60. Number 1, NSAIDs like ibuprofen and naproxen. They increase your risk of heart attack, stroke, kidney failure, and stomach bleeding. Number 2, first-generation antihistamines like Benadryl. They increase your risk of dementia, falls, and confusion. Number 3, proton pump inhibitors like omeprazole. Long-term use increases your risk of fractures, infections, and cognitive decline. Number 4, benzodiazepines like Xanax and Ativan. They increase your risk of falls, fractures, and dementia. Number 5, glyburide for diabetes. It causes dangerous low blood sugar episodes without warning. Now I want you to do something. Look at your medication list tonight. Write down every pill you take daily. Then ask yourself, when was the last time my doctor and I reviewed this list together? Not just refilled it, reviewed it. If the answer is more than a year, schedule an appointment. Bring this video. Ask about each medication. Ask if there are safer alternatives. Ask if you still need it. Then leave a comment below and tell me which medication you are going to talk to your doctor about. Be specific. This helps other people realize they are not alone. Share this video with someone over 60 who takes multiple medications. It might save their life. And if you want more information like this, information your doctor does not have time to tell you, subscribe to this channel and turn on notifications. I make these videos because I believe you deserve to know what is happening inside your body. This video is for educational purposes only. It is not medical advice. Do not stop or change any medication without talking to your doctor first. Stopping some medications suddenly can be dangerous. This information comes from my 3 decades of experience as a cardiothoracic surgeon, but every person is different. Your doctor knows your full medical history. Work together, ask questions, advocate for yourself. That is what I want for every person watching this.